one unique thing about RSNA. When I was a resident in training, I think it was in 1961, I gave my first paper at the RSNA at the Palmer House, and I was active in the scientific program committee here for a number of years, and they asked me to be its chair, and the board asked my opinion, should we leave the Palmer House and come to McCormick Place? Well, at that time, the scientific exhibits were all in individual rooms at the Palmer House, and it was unique because we would sit and use the couches and comfortable chairs to look at our exhibits, and so it was very, very comfortable, and it was quiet, and you didn't have masses of people around you that would interrupt you looking at these scientific exhibits. And so as the upcoming chair, I thought we shouldn't change this, and so I said, stay at Palmer House. We want to stay there. It's more comfortable for scientific exhibits. Well, the board prevailed and wisely prevailed and elected to move to McCormick in 1976. And so I chaired that for 3 or 4 years and started the scientific exhibits here. And so that was very enjoyable. I think you have to go back to the origins of radiology in the early 20th century, in 1900s. At that time, there were just a few radiologists, and it was pretty much confined community. Radiology was just surfacing, and we didn't have any CT scanners or MRIs or ultrasound. We just had plain old-fashioned images, and the original images were on glass plates. And but back somewhere in the 20s, we were able to switch, and the technology improved to plastic film. And so we use plastic film, and there's still places in this country that probably uses some plastic film, and there's certainly places around the world that uses plastic film. And so that's what we used, and all we could do then was chests and bones and things like that. So radiology then had primarily radiologists that met once or twice a year, primarily to look at the progress that radiology has made. Now, RSNA did something very, very unique back in those days. They were able to see that radiology was just not radiologists, but you required a team approach to the entire field. And so whereas a few other societies confined themselves to radiologists, RSNA opened the umbrella and say, we're going to take everybody. We're going to take all radiologists, no matter what kind of practice they had. We're going to include technologists, we're going to include physicists, we're going to include administrators, and we're going to invite industry to come in and show its products. And so from the infant memberships and societies back in the 20s and 30s, RSNA wisely included all of the team of people participating in any radiology department, including hospital administrators. And so as a consequence, people were attracted to this meeting, and that's why it's as large as it is today, and largest in the world. And so that was something they did that was very, very unique, including everybody in it. The other fallout of that was global. Not only did they include people from the United States, but they went out to other countries and invited them to be part of radiology team. So, and even radiologists from all countries now come, but even other team members from other countries come to this meeting. And so that's why, you know, we have 60,000 registrants here. And it was unique because if you look at patient care and what radiology plays, you need the entire team. You just don't need radiologists. You need technologists. You need information people, IT people. You need administrators. And so that's why this meeting is so popular. I've benefited initially when I was in training at Duke. I gave my first paper in medicine here at RSNA. I think it was 1961 or 62, I don't recall. So that was, on a personal level, tremendous satisfaction that I could put together a paper, and it happened to be in a big hall because it was on a dosimetry of cardiac catheterization. And it propelled me personally to do further research and propelled me toward an academic career in radiology. So that kind of got me out of the starting blocks of being able to present material on research, and the fact that it started here made a big impact on me. And years after, I gave many papers here at this meeting and showed many exhibits, and so it personally was a very important part of my career. I would certainly tell them to work hard, and by doing so you'll get a lot of personal satisfaction in what you're doing. And working hard enough, you'll also grow to love your profession. And by doing that, you'll continue in it, and then you'll be able to give back. And you have to give back. You can give back in a lot of different ways. You can give back in your local community. You can give back in your local radiology organizations in the state. And you can give back to societies like RSNA, and giving back to the research and education is so important, because it has helped so many residents in the past since we started this. So loving your profession and giving back in a lot of different ways is what I'd tell you to do. That first paper I just talked about that I gave here in '61 was in pediatric radiology. So, and so at that time, it was related to cardiac catheterization in children with congenital heart disease. And at that time, that was just beginning to get out of the starting blocks. And of course, since then now, that subspecialization in pediatrics has improved so much that so many children with congenital heart defects are being surgically cured. Then you had the introduction in the 70s of CT scanning, and then in the 80s ultrasound, and in the 90s MRI, or shortly before that time. And then so cross-sectional imaging has changed the field of pediatrics so much that fortunately babies in utero are being surgically repaired to have a normal life. And so the element of cross-sectional imaging has changed pediatric radiology considerably. It'll be a totally different field. There'll be a huge emphasis on molecular imaging. We will be able to do things pathologically and histologically that we certainly cannot do now. There will be screening techniques using ultrafine molecular and submolecular and atomic imaging, and I want to emphasize that. Atomic imaging at that time will play a very big role, and by 100 years from now, molecular imaging might be obsolete to atomic imaging at that time, because we'll know everything about the human body down to the smallest level possible, which is in the atomic range.